Ask the Doctor segment is all about how to keep weight off following weight loss surgery. I'm joined by Dr. Cameron Askew from Brookwood Medical Center. Here to take your calls. Give us a call right now, 741-9272. Before we get to our callers, bariatric surgery, most of us think, oh, okay, well then you've got it taken care of. But that weight can come back.
Right. Part of bariatric surgery is making the appropriate lifestyle changes. And I say lifestyle changes, not a diet, because I want people to think of it as permanent. It's very important that the changes we make you stick to for the rest of your life. And as you get further and further out from surgery, sometimes it gets easier to fall back into some bad old habits.
All right, well, let's get to some of our callers. We have Angela in Birmingham. Angela, what's your... Oh, we just... Okay, how about Linda? Let's try Linda from Talladega. Linda, what's your question?
Yes, hi. My question is, I need to have the surgery done for being overweight. But my question is, which one would you think would be the best one? Because I've heard some negative things.
Okay. That's a little bit of a difficult question to answer in just a minute, but because everything is specific to you. So here in Birmingham, most of the bariatric surgeons here, including myself, we offer gastric bypass, sleeve gastrectomy, and lap band. They all have their own benefits and kind of their own risk factors. So the best way to answer that, unfortunately, is for you to come to a seminar, because you need to hear all the risk and benefits of each surgery so that we can make a decision that's best for you.
It is something you need to go into with some education.
Absolutely.
And learn what's going on. Do we have Angela back? Okay, we have Rosemarie now. Rosemarie, what's your question?
My question is, I did have the weight loss surgery about 3 years ago.
Okay.
I was 500 pounds plus, but I'm down to 328. I have gained 10
that's
pounds.
awesome.
Yeah.
And I want to know, besides watching my diet, is it possible? I know I can exercise, but I have a knee problem.
Okay.
What else can I do?
Okay, so that's a good question. You've been very successful. You've lost a lot of weight, which, you know, you should be very proud of yourself for that, first of all.
Yes.
Secondly, surgery it's difficult to get all the way to like a normal or ideal weight just with the surgery, so it is going to be harder for you now to get any more weight off, but you did mention exercise, which is hugely important to increase your metabolism. So if you're limited by a knee, the best thing to do is low impact types of exercise, probably water aerobics being the absolute best, but a recumbent bike, anything that's non-impact that you can tolerate so you can be as active as possible. Weight training in a chair is something I'll get my patients to do. There's actually a lot of exercises you can do seated so that you still get the benefit of muscle gain without affecting your joints. And then from a dietary standpoint, you've got to make sure you're getting enough protein. If you don't get enough protein, which is a minimum of 60 grams a day, your body will hold on to everything. So make sure you're getting enough.
I really think that's what the problem, and I was wanting to know, could I go back on like 2 protein drinks a day, and then well, I can't eat too much, but one meal a day and 2
Yeah,
protein.
I would do 1 protein shake for sure a day. And then on a day that you're really active or you do exercise, it's okay to get a second, but you don't want to replace food with the protein shakes too much. So I would try and just do 1 a day, and then make sure your other 2 meals are high in something like chicken or lean beef or a lean pork, really making sure you're getting your protein from food, from eggs, and then do substitute with 1 shake so you can make sure you're getting enough.
Yes, ma'am. Thank you so much.
You're welcome.
All right. So, and a lot of this is you need to talk to your own doctor.
Yep,
get
absolutely.
the recommendations, what needs to be done. All right, doctor, thanks for being with us. We appreciate it.
Thank you for having me.